One of the most important aspects of surgical care and medicine that is important in our time and that may be lost is continuity of care and patient relationships. I think in the midst of technology and the various options that are available for physicians and the time pressures we're under, we tend to lose that. I think that's the most important aspect of patient care. And that's something that I want to focus on in my practice. One aspect of surgery that is potentially challenging in our time is acute care surgery in the elderly. And part of that is not just doing the operating. It's following the patient and making the right decisions. And that has a huge impact on a population who is elderly and would like to live out their last days as healthy as possible. And one goal that I have for my practice is that we want to do something that gets you better. One particular aspect of care and transitioning care that is occurring throughout the country is the emergence of large tertiary care institutions. But that means patients have to travel out of their home and go to hospitals that are often in distant cities that they are unfamiliar with and they're away from family. And there's a loss of continuity in patient care in larger centers from hospital and in follow-up. And I think that's something that's slowly being lost in larger urban practices. I think the role of a surgeon in a hospital in a small city or town is to try and do what he can there safely, and when he can't, send patients who need tertiary care out in the appropriate fashion. I think that's an important aspect of community-based surgical practice and something that I'd like to bring to the practice here.